Good evening, everyone, and thank you so much for joining us tonight. Before we get started, I would like to share this brief disclaimer that you see on your screen. And that disclaimer is this: the PharmAssist virtual learning experience, brought to you by Mandel's Clinical Pharmacy, is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. And now that we have that out of the way, I would like to welcome you once again to the virtual learning experience through Mandel's. My name is Craig Orpello, and I will be your host tonight. And what is the PharmAssist virtual learning experience, you may be asking? Well, it is an educational program created exclusively by Mandel's Clinical Pharmacy to bring you together with some outstanding healthcare professionals right from the comfort of your very own home. The PharmAssist program takes place every Monday night at 7 p.m. Eastern Standard Time. And tonight we'll be providing a live medication instructional program on 3 fertility products, including an interactive Q&A throughout the program. And how is it interactive? Well, that's where you come in. So if you're joining us via Zoom or Facebook Live, we invite you to be a part of the program and the discussion by sharing your questions in either format, whether in the Q&A or directly into the chat. We are, as always, joined by various amazing HCPs each week from across the nation to provide you with a real-world experience, just as if you were sitting across the table from them in their clinic. And today we are joined by Karen Hammond. So I want to say thank you very much to everyone who has joined us at home. Thank you so much, Karen, for your time tonight. And I want to turn it over to you, Karen. Take it away.
Thanks so much, Craig. And thanks to all of y'all for joining me this evening. Hopefully we can talk about some products that you may have been prescribed and make this really easy for you to give your injections. So I'm Karen Hammond. I am a doctor of nursing practice and as a nurse practitioner. I've been in women's health and especially reproductive health for now into 4 decades. Just had a big birthday that ends in 0, if that wants to give you any kind of little hints. But I'm just really honored that you joined us tonight, whether it's live or perhaps you're going to be watching this later on, because we want you to know that it's really not as intimidating as it seems to think about taking some of these injections that your provider has recommended that you take. Each one has a very specific purpose and has been prescribed to you specifically by your provider in hopes that you're going to have the best outcome possible. So as Craig mentioned, we're going to just talk about 3 different products, including the Gonolife multi-dose vial, Avadril, and progesterone in oil. You may have been prescribed one or all, or maybe even none of them, and you just want to learn a little bit about injections. But the purpose of this is just to help you to find comfort and ease and know that you have a resource in the providers that are discussing these products, as well as with Mandel's Clinical Pharmacy. It's amazing how your provider, the pharmacy, and the nurses and nurse practitioners will work with you and work as a team to try to help you have the best possible outcome, and hopefully have some good news that you will have the next time that you join us. So without further ado, we'll go ahead and start with the first product. Craig, if you want to cue that up, I'll give it a little intro. The first product we're going to talk about tonight is the Gonolife multi-dose vial. Now, some people think, oh, you have to mix it. Maybe it's going to be hard. Maybe it'll be like a science project. But really, all the supplies that you need for preparing this medication or in one nice little compact, concise box. You just need to take out the supplies and follow the directions. It's actually quite easy. And as a bonus for this medication, and one of the reasons I like to prescribe it is because it is overfilled. The dosage is 450 units. That's what it says on the box. But the secret is there's actually an extra 150 units that's in there. So that can help you with saving some money on the medicines. I know many of you don't have insurance coverage for medications, and every unit that you can get in that vial makes a big difference. So Craig, why don't you go ahead and start up the video and then we'll answer some questions. Your prescriber has recommended you take Gonolife multi-dose. It'll come to you in a box like this that has all of the things that you'll need to give your injection. I'd recommend you begin by choosing your injection site. This medication is administered subcutaneously, which means it goes into the fatty tissue of either your abdomen or your outer thigh. I generally recommend people take it beneath their belly button, outside an inch or two, beneath and out, or in the outer part of the thigh. Really, this medication can be administered pretty much any place on your abdomen or your thigh where you can pinch an inch just to make sure that it goes into the fatty tissue. Next, open up the box, and the inside will look like this, where there are syringes with needles already attached, a syringe with liquid, and a vial that has powder in it. The powder is actually the medication. To give the injection, just open up the packaging, remove the vial and the syringe with fluid, and take out just one of the syringes that has the needle already attached. Next, you'll remove just the top off the vial by gently lifting it up. Then take the top off the needle that's attached to the syringe with the liquid in it. Put it into the middle part of the vial, into the rubber stopper, and push in all of the liquid. And it will quickly dissolve all the powder that's at the bottom. Remove that syringe and discard this into your sharps container to avoid injury later on. Then you can open up the needle and syringe, remove the cap from the needle, and again place the needle into the midpoint of the stopper, and you're ready to withdraw your medication. Your prescriber will tell you exactly what dosage is best for you. But for today's instruction, I'm going to suggest that your dose is 150 milligrams, 150 international units. You just pull back to 150 on the syringe. If there's a little air in there, no worries. And it's ready to administer. Then you want to choose a place on your abdomen to give the injection. Wipe it one time with alcohol and bunch the tissue up. Remember, you want to pinch an inch. Then take the needle, put it straight into that area all the way. Push the medicine right in. Release the skin, release the plunger, and pull the needle straight out. If you notice a little droplet of fluid or blood on the area where you administer the injection, no worries, just wipe it with an alcohol pad and cover it with a bandage if you need to. When it's time for your next injection, you'll do the same thing, but the reconstitution is already done. You'll simply just take the vial, withdraw the same amount that has been prescribed for you, and administer it just like you did before. Some people opt to alternate sides or sites when they're giving the injections. Keep in mind that the vials and the multi-dose Gonolife are overfilled, so you'll have more medication than what's actually printed on the bottle. Don't waste that medication. You can still use it. If you have any questions, you can always ask your healthcare provider. But congratulations, you've now given your Gonolife injection. Perfect. So really, how easy was that? You just have all the supplies right there that you're going to need, and it'll be easy for you to just keep in mind what dosage your prescriber's recommended for you and reconstitute the powder with the liquid, and then it's ready to draw up and give that medication. Now, some people are thinking, gosh, giving an injection in my stomach. I hate the thought of that. I know when I was a little girl, my mother, I'm an animal lover all my life. And my mom would always tell me, don't go pet that strange dog or cat because they may have rabies. And if you get rabies, you have to get shots in your stomach. And so that was a thing to keep us from petting other people's animals. So we wouldn't have to get shots in our stomach. And it really instilled a lot of fear in me when I was younger. And now I think, gosh, that's the easiest place to give an injection. If you can take it subcutaneously, there aren't very many nerve endings right there in your belly, and the skin is generally not as sun exposed as other parts like our legs. The skin's softer and just easier to do the injection, and really not uncomfortable at all. So I think giving the injections in the abdomen is actually a good choice. Although the back of the arm or your thigh, those are reasonable choices too. This medication, like I said earlier, is very user friendly, since everything is right there that you're going to need. It'll be shipped to you. It doesn't have to be refrigerated. After you withdraw your medicine, just keep that little multi-dose vial in a safe place out of reach of others until you're ready for the next injection, and then you can just draw that out. So it says there's 450 in there. In my experience, there's generally 600 in there, but get out every single unit that you're going to need. And on the syringes, it's really pretty cool. You don't have to think how many units is 1 cc or whatever like that, because actually the units are what's written on the syringe. So you can just go from one thing to the other to withdraw it. So let me pause here for my comments and turn it back to Craig and see what questions we've got.
All right, how's it going? Perfect.
Hey,
So
hi.
once again, I just want to remind everyone that you can put your questions, if you're joining us via the Facebook, you can just put it directly into the chat. And if you're joining us via the Zoom call, then that way you can put it into either the chat or directly into the Q&A section, and we will get all of it. So no worries there. Now this question came through during the video. So you just touched on some of that information regarding overfill at the end there. But just in case, we'll just get through this question because it does come up quite often, and sometimes people have questions around how the overfill actually works. So the question just came through. It says, can you explain a bit more of how the overfill works to my advantage, similar to what you were just talking about before? And is there anything specific that I need to know to be able to gain this benefit, or is it just something that I'll be able to figure out pretty easily?
Great question. The good answer is, the easy answer is yes, you'll be able to figure it out really easily. When we think about getting these medications FDA approved, and we all have learned a lot about FDA approval process with COVID, but one of the things they have to do is to make sure that you can get enough of the medication out of the bottle to be absolutely sure you can get what is actually labeled on the container. So we want to make sure that there are really 450 deliverable, it's called, units that can be withdrawn from the vial. You may notice each time you put the needle in or take the needle out of the vial that just a little tiny amount comes out. And so that has to be accounted for in the manufacture of these medications. Therefore, we use it to our advantage to be able to get this extra dosing out when it's time for you to take your medications. Now, the way you use it to your advantage is if you've been prescribed more than 450 units for your cycle, then you have that bonus medication that's still in the vial. I remember before I figured out exactly how much overfill there was, I'd have patients call and say, gosh, I know that I looked at the exact amount I was giving with every injection, but it still looks like there's a lot of medication left over. Well, come to find out, there really is a lot of medication left over that is fine for you to use if that's prescribed for you. On the other hand, some people will put the 1 cc in the powder, or the little amount of liquid into the powder, and they'll say, God, that doesn't look very much. How can I get that much medicine out of that? But it is carefully calculated, and you're going to be just fine giving these injections and withdrawing just the right amount. It's really very simple. Other questions, Craig?
Yes, definitely. Thank you very much. That was a great answer. And I know that's one of the things that people get, they want to make sure they're getting the most cost-effective utilization of their medication. So that question, has come up pretty often in all of our PharmAssist programs. So thank you for breaking it down and making people feel very comfortable with it. Because that's the point of the PharmAssist program, is get comfortable now so that you don't have to worry about it later. So perfect. Another question that comes in that says, okay, if I have less than a full shot left in the vial, what is the best way for me to proceed for my next shot?
It's a great question too, and not everybody is going to take exactly 600 units. Perhaps you've been prescribed to take 225 units, and so you're going to have enough for 2 days and then a little bit left over. So since it is accurately measured with the right amount of powder in that little vial, as well as the exact amount of liquid you need to reconstitute it to deliver just the dosage that you're prescribed, what you can do is go ahead at the very beginning, before you drop your medicine, go ahead and reconstitute that next bottle of powder by doing the same steps we've already gone through. Take that syringe, put it into the rubber stopper on the top of the vial, and put in the liquid. Then that second bottle is reconstituted. Then what I'd recommend is you go back to that first bottle, withdraw all of that, see how much you've got, and then you can just put the needle directly into the second vial that's been mixed up and pull back the remainder that you need to complete your dosage. So in this case, you might need 75 units from the second vial if you've been prescribed 225 per night. It's actually quite simple. It doesn't matter at all if you commingle the vials. It's the same medication, and it doesn't matter that one's been mixed sooner than the other. It's ready to go as soon as you reconstitute it. That's a great question, and I see that a lot. You don't want to waste any of it. One of the advantages with using this over a pen device is that with this, you can still do it in a single injection. With a pen, it's not quite so easy to do. If you've been prescribed a pen device, you have to give the last 150 and then start out with a new pen and give a second injection. So this actually makes it a little bit easier for you.
Great. Thank you very much. And like you said, yeah, I think that's one of this probably the second biggest question, other than just actually giving the shot itself or any questions around that, is figuring out the finances around it. And that's one of the things that at Mandel's, where we pride ourselves on being able to assist with that. And we work very closely with your clinic and with your nurses and physician to make sure that we can provide that information with you or to you, so that you are very comfortable in knowing that you're getting the best, most cost-effective options on the market for you. So thank you so much for that great answer. Let's see some other questions that are coming in. Okay, perfect. So stay a little bit on some of the financial side of things. The question comes in that says, a friend of mine told me about some financial programs that are available from Serono to offset some of the costs of Gonolife among some of their other products. How do I find out more information? What do I need to know?
Great question. And as Craig can attest, I am very particular about patients spending lots of money on medications. I know these are very expensive. And once somebody calculated that these medicines are more expensive per ounce than gold. And so we treat this medication like gold. Nevertheless, we also appreciate that not everybody has extra gold to pay for it. So there are some wonderful programs to help you out with this. One are the little tricks about the overfill that we talked about already. But the manufacturer of the Gonolife multi-dose the multi-dose injection actually has a program called Compassionate Care. Your provider may well talk to you about this. I know I always try to talk to my patients about it. But if not, when your prescription is sent to Mandel's Clinical Pharmacy, they will actually walk you through the steps to make sure that you apply for any programs that you can. And one of the caveats about compassionate care, it is only for patients who don't have insurance coverage for the medication. And interestingly, sometimes even if you do have healthcare insurance, it may be cheaper to walk you through the process of just paying for the medicine yourself. The folks at Mandel's will actually give you a little printout of what it will cost if you use your insurance benefits, what it'll cost if you don't, and sometimes the latter is a little bit less expensive. Nevertheless, if you don't have coverage at all, they'll definitely walk you through the compassionate care program that Serono has. You can also Google that at your convenience if you just want to take a look, Serono compassionate care, and that will put you to a website that can tell you a little bit more about the program, how it works, and how to apply for it.
Thank you so much. And I think part of that's really one of the places where on the Mandel side, to your point, Karen, where we excel is really partnering with the clinic and the patient to make sure we have, it's a full team of all three of us on board, and really figuring out how best to make sure that you get, affordable medication, and work together with your clinic to make sure it's what you need, with the best price possible. So the one thing we always like to say is that there's not the special knock. You don't have to know, like the password is, such and such, so that I can get these programs, right? They're there and they're available, and we want people to use them. And we do talk about them and assist patients and the clinics, be able to make sure that the patients qualify for them. So it's a really great way to partner up and make sure that, everything that's available is going to be offered to you. So there's nothing that's going to be held behind a paywall. There's nothing that's going to be kind of misrepresented or not told to you, because we want to make sure that you get the best price possible. So thank you so much. And that's a big part of working together, not only with on the patient side, but also working with your clinic and working with Karen to make sure that we can get that to you. So perfect. Let's see, any other questions coming in? Okay. All right. So how about this one? This is more on the actual technique side of things. So getting away from the financials of it for a minute. But what if I withdraw too much of my medication into the syringe? What about if I injected too much? So two different things, one kind of pre the injection, one after the fact. How do you recommend that patients would handle these types of situations?
Perfect. And both are great questions. So if you withdraw too much medication and you realize that before you give the medicine, before you give that injection, easy peasy. You just take the needle, put it back into the rubber stopper, and you can squirt the excess back into the vial. That way you're not wasting it. You can also squirt it into the sink or a garbage can too, but I would recommend that you put it back into the vial that it came from, just so you're not literally wasting the medication. That's an easy thing to do. On the other hand, if you've given yourself too much medication, if you've withdrawn too much and you don't realize until after you gave it that you may have given yourself too much, usually that's not a problem. I would recommend that you reach out to your healthcare provider and let them know that you took more. They may want to adjust your dosage for the next day, or maybe even want to monitor you a little bit sooner, depending on exactly how much you give that's in excess of what you've been prescribed. My experience is that if you give yourself a little bit too much, it's not going to make a difference one way or the other. But I would try to follow your prescriber's guidelines and instructions for exactly what your dose should be, and try to follow that as closely as you possibly can.
Yeah, I think that's a great point too, because the impact of giving a little bit more, a little bit less of different products has a different outcome. So it's good to ask those questions now and get them out of the way. Ideally, you're not going to stray from the instructions that you're provided by your clinic, and that's the goal. But also, we do want to know, in case if something good does go wrong, we always want to prepare for it. And it's important to know which are the ones where, hey, maybe it might just be a quick update to the clinic and let them know, and then they'll let you know how to proceed. Whereas other times it might change, the way things are going to move forward. So these are great questions to ask now so that you don't have to worry about them later. But we can still always recommend that our probably our best, and Karen, you probably agree, our best response would be try to follow those instructions wherever you possibly can. There's a reason why all that information is there and why it's laid out the way it is. But it's good to know when, that you have a little bit of leeway sometimes and how to handle those situations. So thank you so much for that answer, Karen. We definitely appreciate it. With that being said, it looks like as of right now, we are pretty caught up on questions. So what I want to do, just like every other time, what we like to do is give people a little bit extra time. If, say, that last question jogged a question in your memory that you wanted to ask or something like that, if you're furiously trying to type and get it in on Zoom or on Facebook, we'll give another 30 seconds or so for people to get their questions in. But please keep in mind that if we do move on to the next product, we by all means will continue to answer any questions throughout the course of the program. So don't feel like if you didn't get it in time, it's too late. But I'll throw it back over to you, Karen, just as we get ready to transition to that next product, in case people have any last few questions on the Gonolife.
Perfect. So I think the most important thing for me to tell you right now, and I tell my patients this all the time, it is never hesitate to ask questions. We are here for you. We are resources for you. And you have lots of resources. You have this program. You can turn to mymandels.com/PharmAssist and look at any of these videos. Again, you can watch it, the ones that I've done or the ones that other nurses have done from other parts of the country. You can call the pharmacy, call your provider. I can probably say that there's no question we haven't heard before. So don't think that you're not smart. Don't think that we're gonna talk about you and think, why didn't you know that? You don't know if you don't know. So we want to make this easy for you. This is our goal, and we really do want to help you out. So never, ever, ever hesitate to reach out to your resources to find out the answers to your questions, no matter how big or small they are. If you have a question, it's important and we want to address it. So Craig, did we have any other questions come in before we move to the next product?
No, it looks like somebody might be reaching out right now with a question. I heard a phone. So
Oh,
yes,
yeah.
that is one of
I think it's my mom.
Yeah, it's great. No, it's great. And one of the things, the reason why, and hey, this is live, so it's great. It's we're all real people here. This is not just some robot recording. But no, that is great that you can reach out. We always want to recommend in this program. Part of this program is you can reach out during the program, and obviously that's what it's all about. But this is not the only time that you can and should reach out. That you can always feel free to reach out to, whether it's your clinic directly, your nurses, but also out to the pharmacy, because that's what we're here for, is to really help and to make sure that any questions you have, somebody has an answer for you, and we want to make sure that we're here for you. So glad that hopefully this program is one avenue to provide those answers, but it's not the only one. So feel free to ask. You're not the first time it's happened. This is, you're not going to ever catch anybody with, I've never heard of that before. So it's great to know that you have all that support. And with that being said, it looks like everyone is good with questions for that right now. So we are ready to move on to the next product, the second product, whenever you're ready.
Okay, I'm set. So now that we've already mixed the Gonolife, it's going to be easy for you to do the next injection. It's going to be much easier still because there's no mixing involved. The next product I'm going to talk with you about tonight is called Avadril. Avadril can also be called HCG or an HCG trigger. This medication kind of mimics the LH surge, the hormone, huge release of a hormone that causes the final maturation of the egg and eventually ovulation. So it may be given to you right before you're supposed to have intercourse at particular times, maybe a certain number of hours before an insemination, or maybe it's a certain number of hours before you have an egg retrieval. So this medication is generally prescribed for you to take on a very specific date and a very specific time. The good news is it's way easy to do. So let's go ahead and have Craig load up the video. We'll show that, and then I can answer some questions after we get done with that. I'd like to talk to you about administering Avadril. If your prescriber has recommended you take Avadril, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Avadril comes in a little package like this, and you simply open it up and remove the inside part like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Avadril. Sweet, easy peasy, right? So this medication, again, it'll be probably prescribed for you to take at a very specific time. It does need to be refrigerated. The Gonolife multi-dose vial that we talked about earlier does not. This one does need to be refrigerated until you're ready to give it. If you've been told to take it in the middle of the night, it's perfectly fine to put it out on the counter or wherever you're going to give your injection before you go to bed, and just get up to give it at the right time. I would let it come to room temperature for 20 or 30 minutes just to make the injection easier. Now, there are a couple of ways that you can be told to take a trigger. One of them is with this injection we just talked about, the Avadril. You may have been prescribed to take another kind of HCG that you have to mix. The Avadril is called a recombinant Hcg, so it's manufactured and made in the laboratory, where the other medications come from a human-derived product. So they have to be mixed. There are a number of brands out there, Profazi, Pregnil, Novarel. There's some other generics that you may be prescribed. Generally, it's written so whatever is least expensive between the other products, the HCG only products, it's going to be whatever is least expensive or whatever your insurance requires. If you've been asked or recommended to take the Avadril, that'll need to be written specifically. There's not really a generic for it. And some patients may be told to take a Lupron trigger, and that is a different medicine that we'll address in another video. But it kind of works along the same ways as to causing or acting like a huge release of LH that your body would normally do a day and a half before you ovulate. So I'm going to stop talking here and turn it back to Craig and see what questions y'all have.
Perfect. You did actually touch on something that was in one of the questions that came in right as you were describing some of the differences. So if there's anything else you want to elaborate on or expand on, you may have answered most of this question already, and that's totally fine. But I just want to make sure that we do get a chance to note that it came through. And that question is, other than just being recombinant versus non-recombinant, what makes Avadril different than some of the other HCGs that I've heard about, such as Pregnil or Novarel? So
Okay,
just a little bit of an
perfect.
expansion on what you were saying already.
Yeah, certainly. So I think one of the differences is in the dosing. So since they're made very differently, the Avadril and the other forms of HCG, the dosing may be quite a bit, it will be quite a bit different. The Avadril is 250 micrograms, where the HCG is 5,000 or 10,000 units. In general, it's known that one injection of the Avadril, 250 micrograms, is about the same thing as 5,000 units of the other HCG. Sometimes if your provider thinks you need to take 10,000 units of HCG, they may say take 2 of the Avadril. I think it's pretty forgiving. Your prescriber will tell you exactly what they recommend for you. In general, instead of taking 2 Avadril, if they want you to have a higher dose of medicine, they would just give 10,000 units of HCG, so you only have 1 injection. They work very much the same. They do the same thing. They're both FDA approved, and they're both easy to do. They're both generally sub-Q injections, although the HCG is FDA approved to give intramuscularly. Many of us recommend to our patients to take it subcutaneously. That again will be something your provider will tell you exactly how to do. What do you got for me, Craig?
All right, perfect. Let's see. So seems that a lot of times, and I know you have had this question before as well. We've talked about this on the show, and it comes up quite a bit just about the nature of the timing around Avadril, the fact that the trigger aspect of it and how important it is. And so the question is just more, I guess, a little bit more general about the product. Is just how exactly is the trigger shot being used within my body? Why is it so much more? Why is it so important, especially that timing aspect compared to some of the other medications that I'll be using?
Perfect. So with the HCG, the reason we call it a trigger oftentimes is because it does trigger the final maturation and the actual event of ovulation. This medicine's important so that you'll ovulate. Without boring you too much about the physiology, I'll tell you that if your estrogen levels get up too high, you may not ovulate normally without a trigger shot of some type. But also, we want to make sure that that maturation happens. If you try to do an egg retrieval on somebody and they didn't take their HCG, probably not going to get any eggs, and they're not going to be quite as mature as they need to be. No matter what the follicle size is, you still need that huge release of LH, that LH surge that is mimicked by the HCG injection to do that maturation of the eggs. And the eggs are actually really sticky before they're completely mature. And so they'll stick to the side walls of the follicles and we wouldn't be able to retrieve them. The HCG will make them not quite so sticky, make them more mature. And if we not going to have an egg retrieval, then the egg would release from the follicle after about 40 to 44 hours. Generally, HCG is recommended to be taken around 35 to 37 hours before a procedure such as an insemination or an egg retrieval is scheduled. So you will be told a specific time to take it. And it's really important you try to adhere to that as much as possible. It's also important if you make a mistake and you forget to take it at just the right time, or you sleep through your alarm, or you wonder if the calculations were done right with respect to timing, always notify your provider. I've had patients in the past who have been off by 12 or 24 hours or slept through their alarm. They call me up, your provider, just as we did. We'll try to do everything they can to still proceed with your treatment, but it may shift the timing of your procedure up or down, depending on which way the timing was off. I know I've personally done some egg retrievals 9 or 10 o'clock at night just to try to accommodate when somebody mixed up an AM and a PM. But it's important that as soon as you realize that you've made a mistake, that you call up your provider. That's an acceptable middle of the night call. Let's figure it out and see what we can do to try to make the best of your cycle.
Perfect. Thank you so much for explaining that. I do know there's a lot of questions around that, and people are obviously understandably nervous because of the fact that you have a lot of other products where there's a lot more wiggle room and there is a little bit more leeway if if you're a little bit high or a little bit low, or you're off by a little bit here or there. This, I guess, if anything, I would say the number one thing to take away from all of what you're saying, Karen, really is for people to remember when your clinic gives you a very specific time when you should take something, try to remember that if at all possible, but also know that you're not going to be the first person that has missed it or made a mistake or, swapped the AM PM thing and all that. So to know that your clinic is there and has seen something similar and is going to try to work with you is important. But also remember, if you have your phone, you have your watch, you have a smart speaker or something like that you can set them off to remind you when to give your shot. And those are acceptable reasons to have, 5 or 6 different alarms going off to remind you of something. So thank you so much for answering that. That's great. Appreciate it. All right. So let's see. Another question came in. Okay. So you talked a little bit about the storage and being able to bring it up to room temperature, like about 20 to 30 minutes before that shot is given. And so I guess it triggered, no pun intended, but it's caught off this question that somebody said, what's the best way to store my Avadril overall, just so it's ready for that big shot, especially because of that timing that can also help reduce potentially some side effects?
Well, really, the thing you should do is just keep it in the fridge until close to the time that you're going to give the injection. It's not going to be any big deal if you give the injection while it's still cold. It may feel a little funny putting cold medicine in your warm body, but I don't think it's going to hurt, and it's certainly not going to hurt the effectiveness or the absorption of the medication. It's still going to work absolutely fine. I tell people to put it in the refrigerator where nobody else is going to mess with it, but to put it where it'll be in plain sight for you, so you're not rummaging around, think, where is it? And it's behind the mustard and can't find it. So a place that's easily visible to you, but then nobody else is really going to mess with it. So I would just take it out on the day that you know you're going to have to take that medicine. Just take it out so it'll be ready for you, and maybe up to room temperature a little bit first. I know when I had a younger brother who was a diabetic, and he had to take insulin a few times a day, and he wouldn't always remember to take it out of the refrigerator. And so he would just roll the vial in his palms like that, just to warm it up just a little bit before he withdrew it. It's fine to do that with a syringe too. Most people are a little intimidated to do that because they're thinking, oh, what if I let a little bit leak out? Either way, it's perfectly fine. And if you forget altogether to warm it up, just go ahead and give the injection. It's not going to be painful. It's really not a painful injection at all.
That's great. No, I think these are all the things that help people. You get some of those jitters out of the way now by asking those questions. And this is another great time to remind you that, to Karen's point before, all of these videos, the full video itself, including the just the little individual product videos, are all available for you on our website, available on YouTube and on Facebook on demand. So you can feel comfortable just sitting back and listening to this presentation now, kind of letting it wash over you, learn what you can learn. You don't have to frantically take notes, because you can the day before, or right when you're about to give that first shot, or in with regards to Avadril, right before you're about to give that Avadril, you can go back and watch the video. You can go back and watch this whole thing with the Q&A, or you can just watch the video itself and make sure that you feel comfortable, so that all the questions can be answered through PharmAssist, so that when that shot's ready to go in, it's ready to go in, and you don't have to worry about any more questions. You'll be a pro. So perfect. Thank you so much. It looks like we are all caught up with questions. So as before, I'll toss it back over to you, Karen, and we can give another, let's say 30 seconds or so if there are any more questions before we move on to our third and final product of the night.
Perfect. Thank you. So the Avadril is generally a complement, an additional medication you take with maybe even letrozole or Gonolife, Follistim, Menopur, the other medications that does that final maturing of your eggs and will cause the release of the egg if you haven't, if you're not going to have a retrieval before then. Don't be anxious about taking this medicine. It's very easy. It's already mixed, so most of the work's done for you. You just need to remember to take it at that specific time. So I think I don't see any other questions popping up. So we'll go to the last product. And this is probably the product that I get the most calls and questions about. It's not because it's difficult. It's because it's a little intimidating, because it goes in the muscle of your hip. And this medication is progesterone in oil. So after you ovulate or you have an egg retrieval, your body normally makes progesterone. But if you have an egg retrieval, sometimes it doesn't make quite enough progesterone. So your provider may recommend that you take a supplement of progesterone. There are a number of ways that it can be given, including intramuscularly. It can be given orally, vaginally, even as a skin patch, and there are a couple of other modalities that are in the pipeline to be given later on that are still in the approval process. But the one I'm going to talk to you about now is for the intramuscular progesterone in oil. I don't want you to be nervous about this. Everybody likes to tell horror stories about all of their injections. And when I talk to patients, I say, how's it go? They're just so relieved that it goes so well. So I want you to know that you are so likely to be one of those patients that it goes really well for, as are the vast majority of women. So Craig, if you'll go ahead and cue up that video, we'll take a look at that. And then we'll talk about some questions and some ways that you can make this really easy when you're ready to give your injections at home. Your healthcare provider has recommended that you take progesterone in oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone in oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol, but with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is in oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, it seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to 1 line or 2 to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it. Just 1 time. We know you're already clean. Just wipe it 1 time. Separate the tissue. Remove the top from the needle. Put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. Perfect. So don't be scared about this injection. I promise it's really not nearly as much of a challenge as you think it may be. This is one of those medicines that most people will have their spouse or family member or friend administer for them, just because when it goes in the muscle of your hip, it's a little bit more of a challenge to reach back around to give that medication back there, to give that injection. Two, you want to make sure the needle goes straight in and all the way. And it's a little bit harder to do it from a little bit of an awkward angle if you try to give it yourself. That being said, I have lots of patients who say they'd rather give it to themselves than have to have somebody else give it to them. Whatever works for you is, and that's what we're here to support, is what's going to make it easiest for you. Now, sometimes I'll have patients say for example, the husband's given the injections and he'll think, I love my wife more than anybody else loves theirs. So I'm not going to do that mean thing and put that long needle all the way in there. And they just go in just a little bit with the needle. Those are the people that'll have the irritation, the local reactions where it gets warm, red, swollen, just kind of looks angry where the injection happened. They call me up and say, what happened? And the first thing I'll always ask is, did you put the needle all the way in? And so usually the husband will sheepishly look at me and say, no, I didn't put it all the way. So really the best thing you can do is to make sure it does go in straight in all the way and then push in the medicine. If you do it just like that, the chances of you having any problem with it are very, very small. You may have a little bit of blood or fluid leak out. If you put that extra little bit of air in the syringe, like I mentioned during the video, it makes it much less likely that you'll have any blood or fluid come out. Kind of seals that medicine in the muscle. So those are some of the tricks that I tell patients to do. I also like to draw a target on women's hip after their egg retrieval. So if they're giving it to themselves or somebody else has given it to them, they will see exactly where, and that's anywhere in a little circle that I draw right at their hip at the injection site. Anywhere in that circle that I usually make about that big. So it's a generous area to go around. They can give the injection anywhere in there, not going into the exact same spot every time. That little target adds an extra added layer of security just to make sure that it's going to be given in the right place. Now, I do have people say, oh, way up there, that's my back, that's not my hip. You want it to go to the muscle. So you need to be away from more of a fat pad. And if you give it right in the middle of your buttocks, then that's going to go right into fat. Maybe it's just in Alabama, but we grow pretty big down here, and give it an 1.5 inch needle. If you gave it right into that part of the hip, it is not going to go to the muscle. And that's when people are going to have some irritation. So you want to go way up in the corner to give that injection to really decrease the risk of side effects and make sure that it is an intramuscular injection. We call it a deep IM injection. Now, another little pearl that I'll tell you, it is not the length of the needle that hurts. It looks intimidating, but that is not what makes any medication hurt. It is the medicine as it goes in. That's why people are afraid of getting like a tetanus shot, because that medicine stings. It makes your arm heavy. The progesterone, it doesn't feel any different than any of the other medications. It's just a little bit scarier because the needle's long. But just remember, it's not the length of the needle that makes an injection feel one way or the other. It's the medicine itself. I'm blessed to have had both my COVID vaccines, and I felt nothing when I was having them done on either one. And it's not because of the medication, it's just because it was, it's not because it was a long needle to go into my arm. It's because the medication just didn't hurt. So I think you're going to find that you do really, really well with this, and you're going to be very pleasantly surprised. So with all of that being said, I'll turn it back to Craig, and let's see what questions you have.
All right, we do have a couple coming in, as you mentioned. This one sometimes elicits some of the more questions, just because people have heard a lot or think a lot or assume a lot that may not be correct. So this is a great time to hopefully alleviate some of that. So the first question coming in says, I've heard you guys refer to progesterone and oil as liquid gold on the PharmAssist program. You mentioned, but it says, how does it actually work is the question. You talked a little bit about that, but why is it so valuable compared to the other shots?
Okay, well, I have honestly never heard it called liquid gold, but it is Very, very important because it does help your uterus to support the lining of the uterus to be supported. Normally, after you ovulate, the leftover sac that the egg was in refills with some fluid and a little blood. And that leftover sac becomes a functioning gland that makes progesterone. But sometimes when we stimulate your ovaries aggressively, like for an insemination or IVF, or in cases where we do an egg retrieval, we're taking out part of the components of the follicle, not just the egg, but we're taking out all that fluid too. So the corpus luteum may not develop as normally. It's very important that the lining of your uterus be very stable to support a pregnancy. Progesterone also kind of relaxes your uterus. So it is doing things that will facilitate implantation and holding on to a pregnancy. So it kind of is liquid gold. It's not an expensive medication, so it's not gold in that respect, but it's a very important medication to make sure that your uterus stays stable and relaxed.
Perfect. Thank you very much for answering that. I know a lot of times people just want to know the different mechanisms of action and how things work, but also just kind of when you hear about some of these shots being so important and why you're on them, some super important shots are ones you only take once, and some important shots are ones that you're going to take multiple times. And it's good to know how these things work for some people. Some people just want to take the shot and say, hey, they told me to take it. They told me to take it this time, and that's it. It's good enough for me. I just want to get to my end game of where I'm looking to get to. But other people want to know. You have a number of different syringes laid out and pens laid out in front of you, and kind of what's everything doing. So thank you for making that so easy to understand for a lot of the people out there. That's great. So we do have some other questions that came in. This person is being very frank and honest about it, and it starts with I'm not a huge fan of shots in general, especially this kind of shot, meaning I think the intramuscular aspect of it. Can you share a little bit more about situations where patients may have made a mistake with an intramuscular shot? What can go wrong, and what can I do other than just the bullseye technique that you talked about to try to prevent those mistakes?
Great question. And, I don't guess any of us are really big fans of having injections or fans of needles, but it's so important. And like Craig said, you keep your eye on the prize, keep your eye on the end game, and you want to make sure that a pregnancy can be supported. It's really hard to mess this medicine up if you draw up the medicine and put the needle in all the way. I can't imagine how you could mess it up. Maybe if you didn't push the medicine in, but once you get the needle in, you're going to definitely remember to push the medicine in. The hardest one of these injections is the first injection. And once you realize that it's not a bad injection at all, every other one is going to be easy for you. Now, there are a few things that you can do to maybe help you relax a little bit before you do the injection. One thing is I tell patients to stand up when they're given this injection, and you should stand up, and the side that you're going to get the injection on, lift that leg up just a little bit, and that will actually relax those muscle fibers in your hip where you're going to do it. So just raise your leg up just an inch or so, or just take the weight and pressure off that leg just before the injection. Something else you can do if you're really intimidated by it, or even if your insurance covers it and you just want to give it a try, there are some patches that are available called Sonara Patches. And these actually numb and warm the site where you're going to do the injection. You can put it right on the target. It looks like kind of a big Band-Aid that has the medication inside the bandage part. And you put that right where you're going to do the injection, leave it on there for 20 or 30 minutes, take it off just before the injection. And it just kind of numbs that area, so you're not going to feel anything. I think that is a great option. If your insurance doesn't cover it, again, I'm very cost conscious. If your insurance doesn't cover it, they're about $10 a piece, and you can't reuse them, and you can't cut them in half. They won't work the first time if you try to cut them in half. So don't even think about doing that. But that's an option, especially if you're very intimidated. I have some patients who pass out when they just think about a needle. Those same patients, I recommend when they have blood drawn, maybe they should put on a Sonara patch a half an hour before they have their blood drawn, and that'll numb up that part of the arm too. So those are some options. Just take your weight off the side that you're going to have the injection, and maybe think about a Sonara patch. Talk to your provider and see if that might be something that's right for you. The folks at Mandel's will check your insurance benefits and let you know if that's covered. And some patients, it's definitely worth the $10 just for that security net before they take these medicines. Great questions, Craig.
Perfect. Oh, thank you very much for that as well. It's another one where, you know, people just want to be sure that they understand the process and what they're going to be doing, and how, what sometimes knowing potentially what could go wrong helps you from preventing those, you know, it helps you prevent those issues from actually coming to fruition. So I think a lot of times that's where patients are kind of, you're hovering around, it's like, hey, I don't want to know anything that could go wrong because maybe I'll make it happen. But a lot of times it's just that knowledge is going to help you be stronger when you have to take that shot. And like we always say, get all those questions out now so you don't have to worry about them later, so you don't get those last minute jitters or nerves about things that could go wrong because you've already answered all the questions and now it's just about giving the shot. So great question, great answer. Thank you so much, Karen. Let's see, another one. So you did talk a little bit about the nature of the shot itself, and the utilization and why we take it. But just, I guess, a little bit more, people just want to know, we talked specifically about Avadril being that one-time only shot. So this question comes in, just how long can I expect to take my progesterone and oil, and why would I be taking it for that amount of time? You touched on it a little bit, but a great way to really kind of prepare somebody for the runway that they'll be on.
Perfect. So that's a question really to ask your prescriber, but I can give you some general answers. If you're taking it after an insemination, or maybe after doing IVF, you're probably going to be told to take it for a few weeks. Most people are going to take it for at least 4 weeks. So from shortly after, a day or two after your procedure, up until usually till a heartbeat is seen on ultrasound, and sometimes even beyond that. If you've had a frozen embryo transfer, you may take it for 9 to 12 weeks. Or if you've used donor eggs, you'll take it a little bit longer. The research that's been done has shown that progesterone and oil is generally superior to taking other forms of progesterone for patients that have undergone IVF. In my opinion, I think once you see a heartbeat, it's a little bit more forgiving. I tell patients they can stop taking it once we see a heartbeat on ultrasound. Some other providers recommend that you keep taking it, or maybe change it to a different type of progesterone. And as I said at the beginning, there are other formulations of progesterone. Most commonly, they're going to be vaginal preparations where you use a gel that is FDA approved for this type purpose, or maybe a pill that can be prescribed that's for a different indication, but works similarly. That's something you should talk with about your healthcare provider. If you're getting tired of doing these injections, or if it's getting hard to find someone to do them for you, or maybe you do have a little bit of redness, then talk with your provider about maybe switching it over, because you're going to probably be on this medication for 4 to 10 weeks. So this is one that you take for a while. Most people don't mind taking the progesterone and oil once they find they're pregnant, because they know that it's worked, and they will do just about anything to hold on to that pregnancy. So I more commonly have patients that will say, do I really have to stop taking it? Or I'm afraid to stop taking it because everything's gone so well, and they really want to keep taking their progesterone. So most of the time I see patients having just the opposite thought than what you're probably thinking right now. Any other questions, Craig?
It looks like as of right now, we are all caught up with our questions. So this is a perfect time to let everyone know as we're beginning to get ready to wrap up. As before, if you have any questions from any of the 3 products we talked about tonight, or anything just in general that you want to ask about, now would be the perfect time to do so. I will give, like we said, another minute or so for people who are thinking of questions or trying to type them in. I'll turn it back over to you, Karen, as we start getting ready to wind down towards the closing of the program tonight, but give people a little bit longer before we do so.
Okay, perfect. Thank you. So I'd just like to wrap up a little bit as you think of any other questions that you may have, and say, we are all here for you. Your providers, the staff at your provider's office, the folks at Mandel's, we are all here for you and want to be a resource for you. We want to help you to feel comfortable with what you're doing, and we all have the same end goal, and that's that you will have a successful pregnancy and a baby born several months after that. So we want everything to go well for you. The only question that's a bad question is the one that you didn't ask. And it's so much easier to call up your provider or call the pharmacy and ask your question, as opposed to thinking, why did I not call and ask? I could have done things differently. So please know that we are resources for you, and we want to make this as easy as we possibly can. I just have to applaud the folks at Mandel's for coming up with this idea to do the PharmAssist program, because it is a perfect resource when you think, oh, which way do I do this? Or how do I change the needle? Or what do I do with the needle after I'm done? If you have those questions, you can just go to the mymandelspharmacy.com/PharmAssist, and you can take a look at some of these videos and see exactly what you need to do, even if it's just for reassurance or peace of mind. So this is a great service that the Mandel's Pharmacy offers to make sure that you are comfortable, that things go smoothly, and to be yet another resource to help you with this journey. If there are any other questions, I'll be happy to answer those now.
I think we are all good with questions, which means you did a phenomenal job and you answered all the questions that anybody could possibly have about all three of our products today. So thank you so much, Karen. I do want to say thank you again, Karen, for your time and your expertise tonight, for sharing your personal stories and for having these great answers for everybody. Part of the PharmAssist program is really to help people get to that point where they feel like experts before they even have to give that first shot. And this program would be nothing without you and all the nurses who are a part of this program, who are able to share your knowledge and your time with all of us out here who have, just have questions and sometimes don't know exactly who to go to. And hopefully everyone out there, this has helped you realize that you have numerous locations that you can go for these questions, whether it is reaching out to your clinic directly, or if it's talking with us at Mandel's and asking questions. There's always somebody there who's able to help you. So I want to say thank you again to everyone who joined us via Zoom or Facebook Live tonight for sharing all of the excellent questions that you did. We hope that you were able to learn something, and that we certainly know that somebody else learned something because of your questions. So take some solace in that as well, that you're helping other people with their process throughout the fertility journey as well. So we want to again remind you that they tell me that repetition leads to retention. So all of these videos, as we've mentioned many times before, and Karen just said, the full virtual learning experience videos, or VLEs as we call them, as well as those individual little bite-sized product videos, the demonstration videos, are available for you to find on our YouTube page. You can find them on our Facebook page, and of course at mymandelspharmacy.com/PharmAssist. So you can pull those up right before you're about to give the shot, and you have a chance to find all the information that you need right there. If you are watching this program remotely, on demand, if you're watching this program on demand, we definitely ask that if you're watching it on Facebook, please write into the chat. You can just let us know what you thought about the program. Just let us know if you thought this program was helpful for you. If you weren't able to attend live and ask a question, and you can certainly put questions in there as well, and we will do our best to get to those and share information in the links associated with these videos as well. We do look forward to seeing everyone again here next Monday night at 7 p.m. Eastern Standard Time for another great program with another excellent nurse and resource. If you thought this was valuable, please, please, please share this with somebody that is going through the process like you. So if you have a family member, a friend, a colleague, somebody that you randomly bump into on the street that looks like maybe they want to know all about the PharmAssist program, feel free to share this. It's the best way to get the information out there. So we just please ask, share any way you possibly can. whether it's on Facebook, Zoom, or even just share the link with somebody else. And with that being said, I want to say thank you again, Karen, for another excellent program. Thank you to everybody who joined us at home. We hope you had a good time tonight, and we look forward to seeing you again next time on the PharmAssist program. Have a great night, everybody. Bye-bye.
Thanks, y'all. Good luck in your journey.